Hello, you're watching News Mongolian MNB World. I'm your host, Ayunda Basanko. Our top stories. Regular government session was held on January 12th and several decisions were made. 2,268 local cases, 11 imported cases and 3 additional deaths reported. 2.9 million doses of vaccine are available in Mongolia. For other news, stay tuned. On Wednesday, the regular government session was held and several decisions were made. In our next report, let's take a look at the decisions made during the session. During the regular government session held yesterday, the following decisions were made. Some parts of Damingud was put into a special regime starting from January 10th until April 10th in order to mitigate the social and economic consequences of the coronavirus pandemic, curb price increases, and improve foreign trade turnover, with changes made in the management of trucks entering through the crossing point. In the areas under the special regime, workers, special civil servants, and drivers are isolated under strict precautionary measures, and transportation of the trucks inside the country is organized under special rules. In order to prevent the new Omicron variant from entering the country, people who arrived from foreign countries were put into 3-day isolation. During the session, it was stated that from today, citizens arriving from abroad are no longer required to be isolated, according to a speech made by the Deputy Minister, Amr Sakhan. In addition, the National Emergency Commission was assigned to make it possible for parents with children aged between 0 and 5 to work from home. The Ministry of Health noted that people are actively getting their first and second booster doses. The Minister of Labor and Social Protection, Erwin Zaya, was directed to study the possibilities of raising social welfare pensions, process a government resolution on increasing pensions within the 2022 budget for the Social Welfare Fund, and to have the resolution discussed during the government session. In Mongolia, 63.1 thousand people receive pensions of 5 categories, including the elderly and disability pension. Also, the minister was asked to discuss the registration and allocation of child allowances and saving them as part of the state fund. She was also requested to study and, if needed, make amendments to the law in organizing child allowances in order to cause minimal complications to the recipients. During the session, the payment to be given to citizens and legal entities that supply wheat of high quality to domestic flour factories was set at 80,000 Mongolian tugris per ton. Another decision made during yesterday's government session was to present a draft law to the State Great Hall on ceasing some of the state inspections temporarily. The draft law was enacted in order to mitigate the social and economic consequences of the coronavirus pandemic, improve economic profits, intensify economic outcomes, as ceasing some state inspections for a certain period of time is considered to have a positive impact on business entities. The draft law is expected to be enforced from February 1st, 2022 until December 31st, 2024. The Ministry of Health reported that 2,279 new COVID-19 cases were confirmed today, 11 of which are imported cases. The Ministry of Health today reported that 2,279 new COVID-19 cases were detected after tests were carried out at PCR laboratories across the country. 3 people, 2 women and 1 man, all with underlying health conditions, died of COVID-19 complications in the past 24 hours. All new cases except 11 imported ones were confirmed domestically, out of which 1,752 were confirmed in Ulaanbaatar and 516 were confirmed in the provinces. 5,390 COVID-19 patients are being treated at hospitals nationwide. Additionally, 17,927 patients are being treated at home. Among the COVID-19 patients being treated at hospitals nationwide, 1,436 are showing mild symptoms of illness and 35 are in critical condition. As of now, around 2.17 million people have had 2 doses of a COVID-19 vaccine, and 29.3% of the population has received the booster shot so far. The anticipated COVID-19 peak is to be reached around the Lunar New Year. Hence, officials warn the public against the risk of getting exposed to the virus, and it is advising people not to celebrate the holiday wildly. In the last several months, Mongolia ran out of medical equipment and drugs, but National Emergency Commission informed that the operation to withdraw some necessary medical equipment and drugs is being organized step by step. For example, the National Center for Infectious Diseases has a 2 to 3 month stockpile of 3 to 4 types of antiviral drugs, a 1 to 5 month stockpile of antibiotics, and 1 month stockpile of infusions, and 1 to 2 month stockpile of other drugs.
The National Emergency Commission and the Ministry of Health have instructed all health facilities to stockpile medicines and reagents for 3 months. There was an issue of accounts receivable with suppliers. However, by the end of the year, our center had paid off its debt of 2.2 billion MNT. After that, it is possible to make purchase and organize delivery.
According to sources, public hospitals have a 1 to 2 month supply of medicines. At a time when the Omicron variant has been registered in our country, it is important for citizens to get additional immunization and to support their immunity. To date, 330 people in the provinces have been infected with COVID-19. These people are being treated locally. During the first wave of the pandemic, COVID-19 confirmed people from provinces were transferred to the capital city for treatment. However, with the enhanced capacity of local health facilities, it has become possible to treat COVID-19 locally. The Ministry of Health has conducted respective trainings to local doctors on treating the Omicron variant. Our country has a stock of about 2 million doses of Pfizer vaccine and about 600,000 doses of Sinopharm and 300,000 doses of AstraZeneca vaccines. Officials say that the current stock will be enough for administering third and fourth booster shots for around 3 million people of Mongolia. The World Health Organization advised that the vaccine is stored in the special freezer in around 60 to 90 degrees Celsius below zero. If it's stored properly, its shelf life can be extended by another 3 months. The Ministry of Health assures that the shelf life of the vaccines available in Mongolia is not expired.
Our country has enough reserves of 2.8 million doses of vaccine from Pfizer and Sinopharm. However, work is underway to study and import vaccines for children. In our country, decisions related to vaccination of children aged from 5 to 11 will be made soon. Children aged from 12 to 17 years also need to get booster shots. Children of 12 years old of age and older are also eligible for the booster shot.
At this time, when the number of coronavirus cases is expected to rise sharply, experts say that additional doses can help prevent infection. During the predicted outbreak, the classroom courses of secondary schools will likely to begin. An international study has been conducted on vaccination of children aged 5 to 11 years old. Officials say that similar research is being conducted in our country as well. Now let's check on the currency exchange rates provided by Mongol Bank. And here's the weather forecast for major cities around the world. Well, that's it for today. Thank you for staying with us on News Mongolia. See you tomorrow with more stories and updates. Have a great evening. Goodbye.